Hi, this is Ting O, physical therapist from Physical Therapy and Balance Centers in Hazleton. And I'm here today to show people an exercise that can help with dizziness. One of the problems that happens when people get a vestibular problem is that the eyes don't coordinate properly with head movement, which causes problems with vision and mixes the visual signals to the vestibular system signals, which creates a dizziness problem. One of the exercises that is recommended for that is what we call a VOR exercise, or sometimes also called gaze stabilization exercises as well. They can be very good at helping people start to coordinate their eyes with head movement, and it's something that people can persist with and can really help with dizziness. You have to be careful though, because there is a particular condition that's called visual vestibular mismatching, where VOR exercises can actually make a problem worse. So for the people out there that are going to try this exercise, make sure this is your problem before you try it, so that you don't make your dizziness worse. Okay, so what I'm going to show today is what's called a VOR or GSE, gaze stabilization exercise times 1. And the way to do it is to get yourself something that you can hold on to or get a fixed point in space. What I'm using here today is just a simple business card. And you can see on the back of the business card there's something that you can focus on. So what you want to do is turn that around so that you can focus on it, and you want it to be around about arm's width apart. You can also stick it to the wall. The idea is to look directly at the card so that it's in clear focus, and while it's in clear focus you want to turn your head from side to side, just like this, while keeping your eyes focused on the card. The key to this exercise is to make sure that whatever you're looking at stays in clear focus. If it gets out of focus or it starts to jump around, what you want to do is either slow down or start from the beginning again. So as you start to get better at this exercise, you can start to move faster, and as you move faster, that whatever it is that you're looking at should continue to remain in focus. Okay? And you can also go up and down with this as well. And you can also go diagonals. And the key thing again, make sure that whatever it is that you're looking at stays in focus. So that's what we call a VOR times 1 or a GSE times 1 exercise. And the general rule of thumb is to make sure that when you do it, you don't get dizziness symptoms greater than about a 5 out of 10, because that sometimes can make people a little too anxious. Try and do it around about 60 seconds each time, and 2 or 3 times each session. You can try it 2 or 3 times a day. For people where that is problematic, that can be very helpful in helping with dizziness. But, like I said before, be sure that is your problem, because there is a particular problem called visual vestibular mismatching that can that exercise can make those types of people worse. So if you're not sure, check in with your vestibular healthcare professional, and be sure to get a good, accurate diagnosis of what's going on.